Hi, I want to talk about folate deficiency. Folate deficiency. You've heard about that before, particularly pregnant women? Okay, let's go. There are some few things I would like to clarify. When you hear the word folate, that is the naturally occurring type that is found in our food. I will give you a list of the different food types where you can find them very soon. And you're going to hear something like folic acid. That is the synthetic form. Folate is the natural occurring one. Folic acid is the synthetic form. It's just semantics. It's all about vitamin B9. This is vitamin B9 and it is water soluble. Folacin is the trade name of a type of folic acid. So vitamin B9, which is known as folate or folic acid or folacin, is useful in preventing neural tube defect during embryo-genesis in pregnant women and is very essential in blood formation and DNA replication. So very, very important. That's why in cancer treatment, some medications like antifolate, example is methotrexate, are administered. Why? They want to prevent further DNA replication of those cells. They block the folate, antifolate. So folate is essential in cell division, in DNA replication. And you can understand why a pregnant woman will need them because the fetus is growing now almost on daily basis. So we need it. Folate, like I've said just a while ago, when you hear the word folate, that is naturally occurring form of it. It's just about vitamin B9. Could be found in green and leafy vegetables like broccoli, lettuce, spinach, and so on. Could be found in many fruits and beans. In the West, North America, Europe, and so on, because of the importance of folate, so many cereals, breads, and juices have been fortified with folate. So, because we need it, and unfortunately our body cannot store it for a long period of time, cereals, breads, and juices in North America and Europe have been fortified with folate. So it's very, very important. Okay, we've now learned whether folate or folic acid or folazine or vitamin B9, whatever name you give it, depending whether it's natural or synthetic, is very important for blood formation, for cell division, for DNA replication. So when we have low level of it, which is folate deficiency, what are we going to be faced with? The incidence of that is about 0.5 to 30% of the general population. That's very high. And folic acid is necessary for the normal closure of neural tube during embryo-genesis in the first month of pregnancy. Without that, there will be neural tube defect. Okay, to pregnant women, we're not just loading you with folic acid, which is a synthetic form, just for the sake of it. You need it, particularly the first 3 months of pregnancy, the first 1 month in particular, the embryo-genesis stage. If not, the baby can come out with a defect that is called neural tube defect. Folate deficiency is uncommon in developed countries. Why? I've just said it. Because most food items are enriched with folate. Okay, folate stores are depleted in 3 to 6 months. So we can't store it for a long period of time. They are depleted in 3 to 6 months. That's why we need it in our foods and So, okay, how do we become deficient in folate? Pregnancy. Like I've just said, the fetus is dividing, is growing, then you need more. So because consumption is high in pregnancy, depletion or deficiency will be very, very high as well. It's likely going to be if we don't have external source. Hemolysis, when there is autoimmune hemolytic anemia going on somewhere, or medication or infection going on, then we have hemodialysis, prematurity, infants and elderly because they may not consume enough. Poor intake. Of course, you can't give what you don't have. When there's poor intake, then you have poor level of it in your system. Celiac disease, when the absorption is affected, and the same with inflammatory bowel disease or irritable bowel syndrome. When there is a diarrhea phase in anywhere, malabsorption will occur. Then even if you have taken the natural one or the fortified one with your cilia, but you are having irritable bowel syndrome with diarrhea, inflammatory bowel disease with diarrhea, celiac disease with diarrhea, you are not going to get enough because absorption wouldn't have occurred before going to the washroom or toilet or joint, depending on where you are on the surface of the earth. Short gut syndrome. Well, I think we all know that. I'll make a separate presentation on that later on. Anticonvulsants. Yes. In fact, when somebody is on anticonvulsants, the level of folic acid required will be higher than the general populace. I'll talk about that in a bit. Medications or chemotherapy, I just mentioned it. Alcohol, like in chemotherapy, there's a particular type called antifolate that will work against folic acid itself, so it could be depleted. Alcohol or contraceptives. What are the possible clinical features? Anemia generally in everybody who is having low level of folate. Jaundice if there's hemolysis. Glossitis along the oral cavity, the mouth, the lips, the diarrhea, weakness, tiredness, fatigue, pallor. Maybe somebody has told you you are looking pale or a doctor picked that. Shortness of breath because of anemia, palpitations, the heart will be raising because the heart wants to pump enough to meet the requirements of the body despite the low volume. What are the possible investigations that we're going to do? Do complete blood count to know what is happening to the hematocrit, red blood cells, and MCV, mean corpuscular volume, because we're going to have megaloblastic anemia here. Then we'll do reticulocyte count to know whether the bone marrow is in trouble or there's hemolysis. If there's hemolysis, reticulocyte count is supposed to increase. But if it's not increasing and there's hemolysis, then there's problem with bone marrow itself. Then we'll do blood film to see whether there's megaloblastic anemia here or target cells and so on and so forth. And we can assay the red blood cell folate itself to know whether it is within the normal range or not. And because vitamin B12 and folate deficiency are close in clinical presentation, except that B12 we have neurological deficiency that is not found in folate, then we need to assay the level of vitamin B12 because both will present with megaloblastic anemia. Haptoglobin will give a clue whether there is intravascular hemolysis or not because it's going to be decreased in hemolysis. Treatment. The first thing to do, because my target is the pregnant women, okay? Prevention will start before conception. and it should be 0.4 milligram, that is 400 microgram to 1000 microgram of folic acid. Again, we are back at this name, folic acid. Folic acid is synthetic form, okay? Once daily for 3 months before conception. Why? Because depletion of whatever we store will start between 3 months and 6 months. We cannot store it for a long period of time, okay? Then when the woman is pregnant, we'll continue the same dosage for the first 3 months of pregnancy to cover the period of embryo-genesis so as to prevent the possibility of neural tube defect in the newborn when the baby is here. Now, the dosage is different. 5 milligram per oral once daily if there's diabetes mellitus in this woman, or there is history of neural tube defect already in the previous pregnancy or pregnancies, or this individual is on medication for epilepsy. So the dosage will be very, very high as 5 milligram per oral once daily. So for medical students, 0.4 milligram to 1 milligram is for the general populace, but when there are other situations like diabetes mellitus, previous neural tube defects in this woman, or this woman is on medication for epilepsy, then the dosage is 5 milligram once daily. What are the possible complications? Of course, to the expectant mother, there will be anemia and all the sequelae. I will give a separate presentation on clinical features of anemia generally very soon. Be on the lookout for that. Decreased volume, nausea, vomiting, and anorexia is even going to make the situation worse. Someone who has not had enough, now that is having nausea, vomiting, and anorexia, will not even take enough of natural folate. Now, for the fetus, what's going to happen? Neural tube defect. Neural tube defect. That is the second thing we are trying to prevent. We are trying to prevent anemia both in the mother and the fetus, and now we're going to prevent again neural tube defect. So if we are unable to meet up with the level of folic acid required, then we're going to have that low birth weight. For sure, when there is anemia, you know the child or the fetus is not getting enough. And where will the weight come from? Prematurity, for the same reason. The next presentation will be on iron deficiency. So my advice to the pregnant women is check my presentation on your first antenatal visit and know the importance of regular visitation during antenatal period. During that time, you'll be given this type of medication, folic acid, and you will save yourself from anemia and associated problems, and also prevent neural tube defect in the unborn. Thank you for listening to my presentation. Watch out for more other presentations related to anemia, related to pregnancy, and other issues. Thanks. I appreciate it.